All right. Hello, everyone, and welcome to Facebook Live with the Train with Trust Project and Dr. Sue Dyson. I am Megan Phillips of the Train with Trust Project, here with Jody Ambrose. And as always, we are joined with Dr. Sue Dyson, renowned equine orthopedist and researcher. And today we're going to be discussing a very important topic, going back to the 24 behaviors themselves. Three things that are included in the 24 behaviors list, the Ridden Horse Pain Ethogram, are rearing, bucking, and unwillingness or reluctance to move forward. So we're going to talk about these as a group, and I'm going to go ahead and turn things over to Jody to get the discussion started.
Okay, I think this is the second live that we've done on specific behaviors. The first one we did a few weeks ago was on canter dysfunction. And today we're doing, as Megan said, bucking, rearing, and reluctance or unwillingness. And those are actually in the order of things. I know that none of the behaviors are weighted more than the others, but these are actually the ones that come last. And I was going to start by asking why you wanted to talk about them before some of the others. I think there's some reasons why these are fairly interesting and significant behaviors. Can you just mention
Well,
why?
I think most specifically with respect to bucking and rearing, they are potentially dangerous for the rider. They are frightening for the rider, and they're often not understood because there can be a fairly complex interrelationship between the horse becoming habituated because it's been confused by cues delivered by the rider versus those occurrences when it is genuinely secondary to pain. And I think we have to try and tease out which is which. And the important thing is, of course, that with respect to the 24 behaviors, no single behavior in itself is demonstrative of pain. And we have to say that to know that we're definitively likely to have pain, we have to have 8 or more of the 24 behaviors. But in saying that, bucking is almost invariably the result of pain if it's done on a repeated basis. A horse can buck through sheer enjoyment on odd occasions, but to buck repeatedly, especially to try and buck a rider off, is generally pain related, although that's not the first thing by any stretch of the imagination that most riders think. But rearing alone can be something, and often is, something which has become habitual. Now, identifying what the trigger was is not always easy, but we may well be able to train the horse out of that behavior if the horse is not exhibiting other behaviors. And I guess that I speak both as a veterinarian and as a rider, and as a rider that has bought horses knowing that they rear, but also having been bucked off numerous horses with concussion resulting. So I know the dangers, and I've had clients' horses who've both bucked and reared, as a result of which I've fractured bones in my hand, being the rider. So I think that these problems do need to be addressed and considered in quite detail.
Yeah, I would add to that once a horse is labeled as a habitual bucker or rearer, it can also have really significant consequences for the horse's welfare and their future, because once that reputation is there, it changes the way people treat them. And I've noticed an interesting thing too, is that on social media, a lot of times bucking and rearing gets a lot of engagement, videos of bucking and rearing. And so, as much as they are scary and dangerous and people understand that, they also are sort of fascinated by it. And I think sometimes it can be, it can become something that feeds the rider's ego if they're good at riding horses that do those things, or so it is a really complex concept that comes up a lot. And like you said, I think it's going to be really interesting to tease apart the differences between the different behaviors and within the different behaviors as we go along. So I think it would be good to start with rearing, because as you said, you've bought horses that rear. I actually have sort of a preference to work with horses that rear. It's something that I feel comfortable with. I hate riding horses that buck, but I have had some success with horses that rear, and it doesn't feel always as pain related as bucking to me. And I'm curious about that, what your experience is in your research in terms of rearing and what the causes can be, what that looks like when a rear is coming from pain versus when it's not.
Well, let's consider the horse that has started to rear. Horses learn incredibly quickly, but they unlearn rather slowly. So once a horse has learned that it can rear and it doesn't suffer any deleterious consequences of rearing, it's probably going to continue to do so under certain circumstances. And it often comes about because of confusing cues. So the rider may apply a leg aid or plus or minus a spur, but have the handbrake on through their hand, and the horse is confused, and as a reaction to that, it rears, and then mostly the rider will let go of the rein tension, and they will no longer be applying their leg, and you've removed the aversive cue, as it were. So the horse is getting rewarded effectively for having reared. And then it says, okay, this is fine. I can continue to do this, and I will probably get the same reaction. So it's learned very, very quickly. Now, I think we have to, from a safety angle, consider the horse that can rear and have really, really good balance, which some do. Some can go up almost vertically, and others have a much greater degree of flexion of the hind limbs and seem to be less stable and are more likely to fall sideways or fall backwards. And those are more of a concern because they are a danger to the rider. Yeah. Whereas I don't think that the horse which has good balance is a particular danger to the rider, unless the rider is really out of balance and unable to maintain their balance with the horse. But then they're likely to tumble off to one side, and it's not as though the horse is going to come down on top of them. I bought one horse which I knew was a rearer. It showed no other signs that were in any way pain related. And I bought the horse because if it approached a fence to jump, it would jump the fence. It was cheap because other people didn't want to buy it. Right. And I thought that probably this horse could be retrained. So I bought him as an early 5-year-old. At that stage, even getting out of the yard was potentially difficult. And obviously you don't particularly want a horse to be rearing on a concrete yard, but that's what he would do. And he would also rear under other specific circumstances, particularly if it's out in the middle of a field without anything else to focus on. And just through anticipation of the situations when he might rear and tactical riding and attempting not to reward him for rearing, he gradually improved progressively. And ultimately, there was only one situation in which he would rear, And that was if you were waiting to start cross country and a horse was galloping towards the finish, for some reason that would trigger rearing. So you just had to avoid that situation. So you would say to the starter, please don't make me start whilst this horse is finishing. So if you could avoid the situation, then you had no problem. And he was otherwise a superstar. He went subsequently to 2 Olympic Games and a World Championship, so he really was a fantastic horse. Mm-hmm. But I also have experience of another horse that I bought that I didn't know was a rearer, but he was a rearer. But he showed, on days when he would rear, he showed other clinical signs. He would start becoming resistant. And I'm absolutely sure that that horse had discomfort. Mm-hmm. And he had a mild form of upward fixation of the patella or delayed release of the patella or catching stifles. And I'm sure on days when his stifles were not moving fluently, that he experienced discomfort. Mm-hmm. And as a response to that discomfort, he would be less willing to go and he would rear. And it was only once he became much, much stronger, such that his muscle development and his muscle function was much more synchronous, that he worked out of the delayed release of the patella, and then his behaviors disappeared. Mm-hmm. So those are 2 very, very different examples. And I think that there are quite a lot of horses which rear, which show no other clinical signs. However, if we encounter a horse that spooks, doesn't want to go into the corner, and then rears, if you watch many of those horses carefully, they will show other signs or other behaviors of the 24 behavior checklist, and they are more likely to have an underlying pain-related problem. Mm-hmm. And it's only when that underlying pain-related problem has been addressed, as I did with the horse, my second horse, that the problem will resolve. Mm-hmm. And what is interesting between the 2 is that the primary horse, the horse that I first had, needed to be retrained because it had become habitual, because for whatever was, I don't know what the provoking cause was initially, but it had become habitual. Mm-hmm. Whereas if it is pain induced and is part of other behavioral abnormalities when ridden, generally speaking, once you remove the pain, you don't have to do much in the way of retraining. They stopped doing it because it was the pain that triggered the behavior rather mm-hmm. than the behavior having become habitual because the horse, being quite clever, knew it could do it.
Mm-hmm. Yeah, it makes me think of a horse that I had that many, many years ago, about 30 years ago. So before it was common to use equine dentists or chiropractors or, body workers, I had a horse that used to just out of the blue flip his head back and rear. And it wasn't out of the blue. It was when I touched my right rein. And so I had a sense that was what triggered it. But like you said, if I didn't touch my right rein in certain moments, if I was very light with my right rein, he didn't do it. And so looking back, I think, it was clearly pain related. And I can think of he was very successful. He was a Grand Prix horse and he was very successful. But I can think of, he didn't like to walk from his stall to the cross ties. Like there was unwillingness, here and there that he was sending a message that something was uncomfortable, but it was just in those moments. And I think we'll get more into this later, but talking about how a horse that responds differently with different riders can indicate whether something is pain related or not. I'll ask you more about that later because I think it applies to all of the topics that we're going to cover. So we actually did get a question. Normally I save the questions to the end, but I was going to throw this one in because it sort of relates to what you were talking about. Similar horse, it's a cross country or an eventing horse that will 7 years old, will jump, going out on cross country, will jump 1 jump and then stop and rear. what's interesting is that the horse is okay in the arena and on the flat and in show jumping, but does this going cross country, and it's escalating. And apparently does it when it's the lead horse going out in a group of horses, but will follow other horses. So is that a situation in which, I mean, if you have an eventing horse and it only jumps one jump, that's not something that you can just decide not to do. So would you, would even though this horse has had a full workup with the vet, would you lead with that this is pain related?
I would lead with it being pain related because I think that most event horses love the cross country phase and they normally will jump within their athletic capabilities. They set off and they want to go. They might be less keen about the dressage or the show jumping phase, but they love cross country, any good event horse. And the fact that the problem is deteriorating again makes me think that it is likely to be pain induced. I would say that there are many horses which have undergone so-called lameness workups, but they've never been evaluated ridden. So the attending veterinarian may not fully comprehend what the problem is. And there are many lamenesses that are only apparent when a horse is ridden. And they may be manifest just as a lack of hind limb impulsion rather than the overt lameness that we tend to think of. So I would say that I would personally feel that a repeat investigation, including ridden exercise and paying careful attention to also application of the ridden horse checklist, would be worthwhile, because I suspect that this horse probably shows other behaviours. The very fact that it won't be a lead horse whilst out hacking would indicate to me that it's unwilling, and probably is going to show other behaviors as well.
If it's true that the horse is going well on the flat and in show jumping, would you as a vet ask to see that horse going out in the situation where the rearing is occurring?
I would certainly at least like to see video footage of it. I think we can learn quite a lot from good video footage. I spend a lot of time watching video footage of horses that people are thinking about buying, and I'm often amazed by the number of horses that are in fact lame. They're coping to an extent, but they're not performing as well as they could do. They have fences down, they may stop uncharacteristically, and they show to me clear evidence of pain. So I don't think it's necessarily essential to actually witness the rearing behavior per se, but I would want to see the horse work on the flat, because just because the owner says the horse is working satisfactorily doesn't necessarily mean that it is non-painful, because I think that many riders have not had the privilege of riding pain-free horses, so they don't really know what a pain-free horse should feel like. And also, if its problem has been slowly and insidiously progressing, they may not be aware of how it used to move, compared with how it moves now.
I'm going to throw another question that we got in here because it's related. This person says, my question is, how can you tell the difference between a training issue and a pain issue? Years ago, I put a horse in jump training and they jumped him in draw reins, so I immediately pulled him out. In the 2 weeks of training, he had started to balk and rear. I was able to extinguish it within 30 days. I've also worked with rescues where it was a training issue or lack of good training, and I've extinguished the behavior in the horse that was trained and highly reinforced to rear. Since lameness pain issues can be missed, which is what you just said, how do you delineate pain from training and lack thereof? All of the horses mentioned above went on to have great careers, and soundness was clearly not their issue, but it's always in the back of my mind, especially things like ulcers.
Well, let's come back to the ulcers, but first of all,
we're going to do a whole live on that in a couple of weeks. So
that if the horse is making progressive improvement with appropriate training, then it is probably a primary training problem rather than a pain-related problem.
Mm-hmm.
If the horse fails to improve with appropriate training over a period of weeks, then you have to ask, why isn't the horse improving? There may be an underlying pain-related problem. And it again comes back to using the checklist that can help facilitate the identification of 8 or more behaviors of the 24, which indicate that the horse has likely got an underlying pain-related problem, although a small proportion of lame horses will score less than the threshold of 8 out of 24.
Mm-hmm.
I think ulcers get blamed for a wide spectrum of things for which there is no evidence. And we're going to discuss that in a few weeks' time.
Yes.
Just to say to everybody, don't overestimate what ulcers do. Ask, why are the ulcers there?
Yeah, and I'm going to also touch on something that was in that sort of was just a quick aside. She said that she has been able to extinguish rearing in a horse that was trained and highly reinforced to rear. I happen to know the person that asked this question, and she's a really skilled positive reinforcement trainer. And I myself have also trained horses to rear on cue. And one of the interesting things I find about rearing is that when you do train a horse to rear, they seem to really like doing it. It's a very self-reinforcing behavior and can be very difficult to extinguish. So as a behavior consultant, I would also raise the point that if you are going to train a horse to rear, or if you have a horse that's trained to rear, it's very, very important to have stimulus control, to have that on a very clear cue, and that it only happen when you give that clear cue. And I won't get into the fact that sometimes it can be a good way to stop it is to get it on a very clear cue. You have to be a very skilled trainer to do that. But once it is reinforced, it may occur more often as well because it is self-reinforcing and fun to do. You see horses rear a lot when they're playing with each other and playing with toys and things like that. And so that's something I think it's important from a behavior standpoint to be aware of when you're talking about learned versus pain related. Yeah. It may be increasing because it's being reinforced either by you unintentionally or just by the fact that it's fun to do. And in that case, it's a good idea to get help from someone that is good at really establishing clear cues and if necessary, extinguishing using operant conditioning.
Absolutely. And I think with both rearing and bucking, it's really important that if you as a rider have lost your confidence in the situation,
mm-hmm.
then you need to seek the help of somebody who is a more confident individual. Because if you are going to, for example, train the horse out of rearing, you've got to approach it in a positive way and not necessarily in a forceful way.
Mm-hmm.
But if you are apprehensive,
yes,
that is transmitted so readily to the horse, and the cues that you give will not be direct enough. And it's going to be a potentially disastrous situation.
Yeah, I agree with that. And I would add that as a trainer or as an instructor, people when they're scared tend to pull in, and that is the absolute worst thing that you can do on a rearing horse is pull into your body. That makes you stop going forward, and it makes the horse go backwards and up and over. So that is a scary situation. So let's go ahead and move on then to bucking, because I know that you feel that there's a difference there in terms of all the things we were just talking about. And you mentioned already that bucking is more often something that you can assume may be pain related as opposed to learned. What would you say is the incidence of learned bucking versus pain related bucking?
95% of pain related.
Okay.
And this is verified by all sorts of people that I have spoken to who've had experience in the investigation and management of bucking behavior.
Mm-hmm.
I had a discussion with Gemma Pearson, who's both a veterinarian and a behavior specialist, just a few days ago, and she says that in her caseload, probably it's closer to 100% that are pain induced. And I think the bucking, let's just think that to me, there are two types of bucking. There are horses that buck with their back arched, which I call an N-shaped buck. And I think we have a photograph of that potentially.
Megan?
So,
there she is.
So this is an N-shaped buck. So the horse's back is flexed, and they will often do this repeatedly. And then we have what we call a U-shaped buck. So the back is extended. Now, these are two very different bucks in terms of rider safety. With this U-shaped type of buck, it may unseat the rider a little. It may frighten the rider, but this is not a buck that is done to get the rider off, by and large. This is directly pain induced, whereas if we go back to the previous photograph, this is difficult to sit to. These horses will do this leaping into the air repeatedly. They may also spin, and these are horrible to stay on, and are potentially multifactorial in terms of their source of pain, whereas the horses with the U-shaped buck, the other type of buck, the most common cause is lumbosacroiliac joint region pain.
Okay.
And these horses will invariably be worse in canter than in trot. They will be far worse with a rider on than without a rider. They may repeatedly kick out with one limb. They may do humping type bucks going into canter. They may be reluctant to canter. They may be reluctant to maintain the canter. If they're badly affected, they may start to do it in trot as well. But the characteristic invariably is that these are horses that are much worse in all of their behaviors and willingness when they're ridden compared with on the lunge, and they're worse in canter than in trot. And as I say, these horses are not trying to get you off. They're doing this as a direct response to pain. And if I take away the pain by the use of local anesthetic solutions, so I'm injecting local anesthetic around the sacroiliac joints, then this behavior will immediately stop.
Mm-hmm.
Some of them are straightforward to manage and will respond to local injections. Others, particularly if they've been more long-standing, are more difficult to treat successfully. So this type of bucking, and this may occur either in canter, or we often see it in horses that show jump. They will land after a fence and buck and kick out. And some people misinterpret that. They say, oh, the horse is so enjoying what it's doing. But if you look at them, they've got their ears back. They've often got their teeth bared, as we see in this photograph. This horse is showing the white of its eye, the sclera. So it's showing obvious additional signs of discomfort in addition to the bucking.
Mm-hmm.
So when people say, oh, my horse is bucking on landing because it's enjoying jumping so much, I say, I don't think that's the case. They jump okay-ish. They often are more likely to buck after a fence if they've had to get in deep to the fence and push more with their hind limbs to clear the fence. And then on landing, they will buck and kick out.
Mm-hmm.
And obviously, it is a time-wasting thing, and show jumping competitions are usually won on time. And so it's a problem that I think needs to be addressed, even if the horse is continuing to jump satisfactorily, which some of them do.
Yeah, when I mentioned earlier about people posting videos on social media of bucking, I I don't know if it's a recent trend or something that I just noticed recently, but it seems like there's a lot of people posting those sorts of jumping horses who buck between the fences and treating it as sort of cute and funny and adding dialogue to them. I mean, I think a lot of times it's assumed to be freshness. And are there cases in which you think that that can be identified as the cause?
I think the horse that kind of hasn't been worked very hard for a few days and then comes out and you go into canter and it bucks a couple of times and then works through it and doesn't continue to buck, that can be related to freshness. You take the horse to the beach to have a gallop along the beach. I would never go without an extra because I know horses buck under those circumstances because they say, "Oh, hey, this is great."
Yeah, like they do in the pasture. Yeah.
Yeah. But they don't do it repeatedly. They don't. Once they've done it, you turn around and go back down the deep. They don't do it again because they've had their wahey moment. So I think that the difference is that the buck, which is pain related, tends to happen on a repetitive basis. It continues during a work period and may in fact get worse during the work period, depending on how you are working the horse. And when we go back to the horse that bucks with its back flexed, we run into other problems as well, because so frequently that results in the rider falling off. And then some horses get very frightened by having decanted their rider. And then a fear aspect comes into it as well. So you've not just got pain-induced behavior, you have got an element of fear and stress.
Yes.
And then you've got trigger stacking. That means you've got several different things compounding the issue, which is going to make potentially the whole situation worse. And then the rider is often apprehensive about getting back on. And we've already talked about the fact that an apprehensive rider is going to be overly strong with their hand cues, and the horse then feels restricted, and restriction is likely to provoke the behavior of bucking, whatever the underlying pain is. And when they buck like this, there are many different potential sources of pain. It could be the saddle. It could be the horse's primary back problem. It could be a rib problem. It could be a sternal problem. It could be a lameness problem. There are so many different factors. These are more challenging to identify the underlying cause. And I've certainly encountered a small proportion of horses in my career in which they have been terrible buckers. Even on the lunge, they've exploded in a rodeo series of bucks such that they've escaped from the handler. And those horses can be incredibly difficult to investigate. And because they've become so dangerous, ultimately often finish up being humanely destroyed because you can't get to the bottom of what's causing their problem.
Right. Like I was saying, it really has connotations for the horse's long-term welfare. I'm actually currently just starting to work through a case with a client that is kind of involves a lot of what you just said. This horse is new. They just went through a very extensive vet check, including images of the spine. And so, there's obviously not 100% certainty that there's no pain, but a lot of things have been ruled out. And this horse has been at this new home for about a month and has bucked someone off twice. And so I have consulted just once with them and started trying to peel away the layers. And what I found is a number of things. One is that this horse has been moved around a lot. This horse has been in 3 different countries, a couple different states in the U.S., has been in a sale barn where it was being ridden by a number of different kinds of people in a number of different kinds of ways. So it's been through quite a lot that's going to take some time for it to feel comfortable in the environment that it's in now. And so when this horse bucked the first time, it was a spook, and then a buck, and then stop. And then the second time it was a different person, and he was shifting his weight around, and the horse started to speed up a little bit, and then he may have, lost his balance a little bit or tried to rebalance, and then the horse started bucking, and he came off. And so we're still at this early stage of investigation, and like you said, I am not ruling out that there was some pain involvement. It's happened twice in the matter of a month, but also there's all these different triggers stacking, all these different elements of anxiety. And when I went out to work with them, I noticed pretty early on that when she just was near the mounting block, the horse was exhibiting a lot of the behaviors that I would, attribute to anxiety. And I said, well, if this horse is anxious before you even get on, then probably you can be pretty confident that he's anxious about being ridden. And so, we're going to work backwards, and see if we can get him more comfortable. She's fine with not riding him for a while, and just see if he can get comfortable in his environment before we start to investigate whether it's a training issue, or whether it's a pain issue. So it is a process, to tease out. I don't think there's any, easy way to when the horse isn't exhibiting, behaviors other than the bucking, then you can, get right into it and start investigating. But I think with all of these different things that this horse has been through, we can remove them fairly easily by just getting him more comfortable and getting him, starting to see where the signs begin. So other than pain and trigger stacking, are there other ways that in a situation like that where you would start, like, what are some of the other 24 behaviors that might accompany some of the causes, the pain causes that you would attribute bucking to?
I mean, any of them. I mean, you can
Any of
have
them?
any of them in any combination. It's just an individual horse thing as in terms of which behaviors that they show.
Mm-hmm.
I don't think we can ever, just thinking about the simple things, underestimate the role of tack. So
Yes.
I've had the situation when I have examined a horse, the saddle is an ill-fitting saddle, and that is the provocative factor that is causing the horse to buck. I had the situation when I worked in the United States and I was riding horses for Bruce Davidson. I was given a 5-year-old to produce that was called Buck. And I thought he was called Buck because he was a buckskin. And he would often, if I was riding in the evening after work, be tacked up for me on my arrival. And I arrived one evening and he'd been tacked up, and I took him out into the grass arena and got on him, climbing on the fence. So got on him from the fence, and he exploded in a rodeo going down the entire length of this grass field and then ground to a halt by the fence, depositing me. And then I looked at his tack and found that he had a girth on with an elastic inset. And apparently this horse was incredibly sensitive to a girth with an elastic inset. And if I'd always ridden him before in a girth without an elastic inset, and I always rode him again with a girth without an elastic inset, and he never did it again. But they had learned previously about this, his sensitivity to a girth with elastic insets. For some horses, they're more comfortable with an elastic inset, and others they're not. And I would always say that in horses where they have been bucking and they have had a girth with an elastic inset, to do without it. There are some horses that become incredibly sensitive to light pressure applied in the girth region. So if you just run your finger down and stroke them, the normal horse hardly reacts at all. But if you get a really exaggerated reaction with the skin reacting and the horse reacting, then I think some of those horses have hyperreactivity of the lateral thoracic nerve, which is fairly superficial at that location. And in those horses, and those horses tend to be horses that react when you put the girth on and may explode into bucks as soon as you get on them and become potentially very dangerous to ride. But if you infiltrate that sensitive area with corticosteroids and you retrain them by always girthing them very slowly, moving them forwards and backwards with the girth loose, then tightening the girth a hole on either side, then moving the horse forward and backwards, and then repeating that, and then putting the horse on the lunge, and then getting on it, many of those horses can be satisfactorily managed.
Can you talk a little bit more about treating that area with steroids? Because that's not something that I think I've ever seen done. And I read that in an article that you published and thought, oh, that's really interesting. What? Tell me more about that.
It's a very simple local injection done in the area of hypersensitivity. I usually do it on both sides, even though often one side is much more sensitive than the other. I will always do both sides. And normally the response is very rapid. They improve with respect to their reaction to palpation within days. It may take 2 to 3 weeks to retrain the horse in terms of its reaction to being tacked up and mounted. And
so it's not like injecting with anesthesia where the behavior would disappear right away.
No. This is using the steroids as treatment because I've identified what the problem is by palpation. I've seen enough of them. I recognize it as a syndrome. I don't know why it occurs. Is it damage to the tissues by an over tight girth? That I don't know. I think people do tend to over tighten girths. And I don't think they necessarily pay enough attention to the fit of the girth to the shape of the horse, nor pay enough attention to maintaining a girth which is reasonably soft. So they have a leather girth, they let the leather get far too stiff and have hard edges. So I think you have to pay attention to all these details. But that is one scenario when I think the bucking is pain induced, but it is a potentially manageable scenario. We've also had horses, for example, which have sustained sternal injuries or rib injuries, and you've had to allow time for the osseous pain to resolve. And then sometimes you do have to go through a retraining exercise to an extent, so that they are not apprehensive about the application of the girth and the rider getting on. And with all of these horses, I would always say, once you've experienced a problem like this with a horse, even if you have resolved it and taken away the underlying pain, we always have to be aware that it could recur, and therefore attention to how we tack up and mount the horse has to continue. And things like either always getting on the horse from a high mounting block, so you're not in any way creating torque when you're pulling on the saddle as you're getting on, or always being given a leg up, I think are things that I think are part of the important aspects of management down the line.
Yeah, I think that's an important distinction between the diagnostic anesthesia that you talk a lot about in terms of taking pain away completely all at once and seeing the behavior stop versus treating pain and needing time for the horse to figure out that it's feeling better. Can you talk a little bit, in addition to the steroids, can you talk a little bit about using, I know it's pretty common to like put a horse on bute for a day or two and see if bucking improves?
I think that the use of pain-killing drugs can be helpful in some horses on the assumption that you use a high enough dose for long enough.
Mm-hmm.
Because people will tend to say, oh, I did a bute trial. So they gave the
Mm-hmm.
horse phenylbutazone. And then you say, well, how much did you give it? And they say, well, I gave it 2 sachets on the first day and 1 sachet on the second and third days. It didn't make any difference, so I stopped.
Right.
Well, for, say, a 550 kilogram horse or 1,000 pounds, whatever, that's not enough, and it's not for long enough. So we have to give a dose of phenylbutazone, which is appropriate to the horse's body weight, which is continued for a sufficient length of time, so that we can be sure that we have given the drug a chance to provide adequate pain relief. And we also have to acknowledge that you can have 2 horses with the same problem, and one will respond to phenylbutazone and the other will not.
Mm-hmm.
Lots that we don't understand about pain mediation in different horses. So if the horse improves during medication or deteriorates after cessation of medication, and we're riding the horse during this time, then we can say that there must be an underlying pain-related problem.
Mm-hmm.
But a failure of the horse to respond doesn't preclude a pain-related problem. And
Okay.
that's, I think, really important to recognize, that just
Yes.
because the horse was given phenylbutazone at an appropriate dose for a long enough period, if it doesn't improve, it does not mean there's no pain. There still can be pain.
Right.
And then people say, well, my horse historically has had gastric ulcers, so I'm scared to give it phenylbutazone.
Yes.
Well, that is a fallacious argument, in fact. Indeed, there was a study done in polo ponies, which have a very high incidence of lameness. And those that were given phenylbutazone had less ulcers than those that didn't have phenylbutazone.
Oh, wow.
Because those horses that didn't have phenylbutazone were lame and therefore stressed because they were lame.
Oh,
so
interesting.
The removal of pain is a plus. And
I'll go ahead and tease again that we're going to do another one of these on ulcers, because that is a whole, I mean, I think that is fascinating and not at all what people have been, have been taught to expect. Exactly. Very interesting. Are there other medications you might use besides bute to?
Lots of people use different things, but I don't think anything is as effective as phenylbutazone is for the management of musculoskeletal pain.
Okay.
So people use Metacam, they use Flunixin, and a variety of other products. And I think that none of them are as effective, and they are all considerably more expensive in whichever country you are.
Mm-hmm. The other thought that occurred to me when you were talking about tack is, and this is something that I've considered with this new horse that I'm working with, is that a saddle may be fitted to the horse, but you have talked extensively about the importance of the fit to the rider. And if there's a different rider, that can actually change the way that the horse experiences its tack. And that leads me to a question I have about different riders and different skill levels, and bucking in particular, but rearing as well. And is there something that you can glean from the fact that a horse will buck with one rider and not with another? Does it mean if a trainer gets on and rides the horse and it doesn't buck, does that mean it's not pain?
No, because I think that a skilled rider can ride through things, which does not necessarily mean there is not underlying pain. It may be that the horse doesn't have pain, but you can't conclude that, I don't think, because I guess earlier in my career, I thought more that if a problem could be ridden through by a better rider, then it had to be the rider that was the underlying problem.
Mm-hmm.
And I think I learned the hard way that wasn't
mm-hmm.
the case. And I look back and think I can remember 2 horses definitely when I made the wrong judgment, because I got on these horses and I could ride them and they seemed to be absolutely satisfactory.
Mm-hmm.
But they came back to haunt me. I was wrong.
Yep.
And I will hold up my hands and say I was wrong, and I learned from that. Just because a rider can make a horse do something doesn't mean that that horse doesn't have underlying discomfort.
Yeah, I have a horse that haunts me from childhood that would buck and kick, and actually we're going to move on to Unwillingness. His main behavior that was problematic was that when we went to shows, he would buck and kick out, but only in the show ring, and he never did it with my trainer. He always did it with me, and so I spent a year thinking that it was me as a rider that was causing the problem. And then one day we were at a show and he colicked, and it turned out that he had enteroliths. He had 4, grapefruit size enteroliths in his gut. And, I look back on that and think for a year, this horse was indicating that he was in extreme pain, but it had to do with, like we talked about, trigger stacking, that, the stress of being at a show. And actually when he did eventually colic, it was at a show where it was 120 degrees out. And so the heat was a factor, and my trainer was skilled enough to ride him through it. And he probably was less stressed with my trainer on him because she was a better rider than me at the time. And I think I'll come back to a point that you make all the time, which is that it never hurts to assume that there's a pain related cause and investigate further. It's the ones that you don't, that you look back on and regret. And so let's talk about unwillingness a little bit, because we're grouping that in with bucking and rearing as well, which is a little bit more, I think in the ethogram you call it reluctance, and unwillingness is maybe a little bit larger category than just reluctance.
We categorize it as having to have repeated verbal encouragement or repeated stronger leg cues,
right?
Or even stopping spontaneously, and I think those probably go as a progression. And I think that if we look at most horses that are unwilling, it's generally seen in association with other signs of the Ridden Horse Pain Ethogram model checklist. We would very rarely see this as an isolated factor occurring just alone, and therefore being a behavioral problem. In saying that, I think that there are horses that become almost shut down, unresponsive to cues, because they are chronically stressed and become less responsive to any intervention at all. And it can be compounded by the fact that some riders have no idea what they're doing. They're constantly nagging with their legs, and therefore the horses become habituated to that nagging with the legs. And they've got to learn that a short, sharp cue, perhaps reinforced by a tap with a schooling whip, and then release, then allowing the horse to go forwards, then the horse has got to learn that that is a cue to which they should respond.
Right.
So I think we do see a small subset of horses in which they've become unwilling because of the way that they have been trained. But in many, there are other behavioral signs which indicate that they have underlying discomfort.
Yeah, that brings up a couple of behavioral concepts that we as the Train with Trust project are always trying to emphasize to people. One of which is, and there's been a lot of discussion online this week about different forms of operant conditioning. But in general, and you've talked about how bucking and rearing can both be reinforced by removing the pressure. Most of riding is done through applying pressure and then releasing it when the horse does what we want, which is negative reinforcement. And if a horse bucks and gets the rider off, that's removing the aversive, that's negative reinforcement. If a horse rears and you release the rein, then that's negative reinforcement. And same with applying the leg and removing it, that's negative reinforcement. If you don't remove it, there's no reinforcement of the horse doing what you're asking for. And so it's important to understand what tool you're using and how it works. And then another important behavior concept that I've learned from working with people who work with other species is the concept of precursors, which are things that come before the problem behavior. And what you're talking about, a lot of the other 24 behaviors tend to be precursors to unwillingness, I think, where the horse tries and tries and tries to communicate that something's wrong. And then when it reaches the point of unwillingness, that's because those other signs have been ignored. And, a good example is with dogs, when they growl, that's a precursor to biting. And if you punish the growling and extinguish it, then you go straight to biting. And I think a lot of what you're talking about is similar in that, if horses get punished for signs that are actually pain signals, it can actually suppress them. And then you go straight to bucking, rearing, and unwillingness, which are more dangerous and more, bigger problems and harder to deal with. So it's, that intersection of behavior and what you do with your veterinary research, is what makes your work so unique, I think, is really paying attention to, not just the behavior, but our role that we play in either making those behaviors happen or making those behaviors not happen, which cuts down on a horse's ability to communicate how they're feeling. So I think that's most of what we wanted to discuss. I know I had a question from some of your work that I read about rider balance and how that can contribute the upper body balance. Can you talk a little bit about that?
I think that we must never underestimate the influence that a lack of balance can have over a horse's comfort. So, particularly horses which have got underlying problems, they may be able to cope, assuming that the rider is well in balance. But when the rider starts to get out of balance, then it accentuates their discomfort and they're going to react accordingly. And I therefore think that we have to think about the horse tack rider triad as one. We can't take any separate piece as a single thing. We have to think about the combination, which is one of the reasons why I feel when we're investigating any of these types of problems, it's so essential to see the normal rider ride the horse unless they've become too frightened. And I'm never going to force a rider to ride the horse. It has to be their volition. Because it's important, I think, that they don't feel terrorized in that they've got to get on.
Which is culturally, I think, something to really emphasize because, there is a culture of if you fall off, get back on, don't show fear. And, it's often one of the most powerful things you can do is tell somebody you don't have to get back on and it's okay to be afraid, but you should be afraid because the thing that's happening is actually dangerous.
Yeah. But at the same time, I would say as a rider that there are potential benefits from a confidence point of view of getting back on if it is safe to do so. From an investigative point of view, I've had the situation when I have been investigating a horse which both bucked and reared, and the rider was bucked off during the investigation. We were only partway through. I said, do you want to continue or not? It's no pressure for me. He said, we've got to get on. I've got to get on. We're only going to get to the bottom of the problem if I get back on. Mm-hmm. Unfortunately, we were able to identify what the underlying problems were. And that horse, once its pain was removed by the use of nerve blocks, went really, 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 really sweetly. Whereas before, it was a stop, start because it didn't want to go, or it would spin, or it would pronk, and or rearer and then pronk.
Mm-hmm.
So it was a thoroughly misunderstood horse, but ultimately its problems were unveiled.
Mm-hmm. That was another interesting thing that I saw, I think in the same article that I read, that where you talked about the steroids in the girth area. There were images of basically like a rider, a simulated rider, sort of rider dummy. Is that something
Yes,
that's
yes.
available?
There is what's called an Ardle dummy, which is made by, I think it's an Irish-based company. But it is a kind of life-size model of a person with lead weights in the legs of the person. So you can put this on the saddle and it's attached to the saddle so it doesn't move. The
Mm-hmm.
upper body is collapsible, and that's quite useful because some of these horses have become frightened by the presence of a rider and that rider falling off. And sometimes when you're retraining them, the use of the dummy can be useful.
Mm-hmm.
And you need to collapse the dummy because the horse is afraid of that torso being up here. You
Right.
fold it down, they're less aware of it. They're becoming attuned to carrying the weight. They become progressively more acceptant of that. And then you can progressively increase the height of the torso.
Interesting. That's very interesting. That I think that was in the article that you shared, that you said is not something that's publicly available. Is there a way that we can make
Um,
that?
Yes, I can't put it on the website because it's not an open access article, but if anybody wants a copy of the article, which is all about bucking behavior and the underlying causes and how we would investigate those, you can contact me either directly or through the Train with Trust website.
Yeah, we have form on the 24 behaviors, it's 24horsebehaviors.org website that people can submit a request for that, and we'll get that. We can probably email that out to people. That would be great. Okay, Megan, do we have any other questions?
We did have a couple of questions come in during the during the live, and one of them was what might cause bucking after flying change.
Oh,
And
that's a good one.
my thought is you kind of illustrated that 95 to 100% it's pain, right? And you talked about some of those, but you might reiterate.
Yeah, I think probably the most common cause of bucking during flying changes is either hind limb pain, which is primary, and the most common cause would be upper suspensory ligament problems, or a component of lumbosacroiliac joint region pain. And you could probably differentiate that clinically by examining the horse, seeing its responses to palpation, and observing the way in which the horse bucked.
I would uh, maybe also add that when the horse is first learning, it might be common for bucking to occur, and that might be frustration. But like you said before, horses have that ability to learn. I think you've said 2 weeks basically is sort of a good rule of thumb, that it might take a horse to learn a new behavior. So if it's escalating or continuing after a certain amount of time, then it would be more concerning. Is that right?
Absolutely, absolutely. And I often say, because there's quite a high proportion of, for example, upper level event horses, which have a component of sacroiliac pain, and I
Mm-hmm.
watch them warming up for the dressage, and I watch them do the flying changes, and the horses get progressively worse.
Mm.
And so I say to myself, why practice the flying changes during the warm up? The warm up should be just that, warming up the body,
Mm-hmm.
enabling the muscles to be ready to work.
Mm-hmm.
Why do something which is difficult during the warm up? This is
Right.
not a training time. This is getting your horse as suitable as possible to go in the arena and do as good a job as possible. So avoid the difficult things, because if you haven't trained it by now, you're not going to be training it between now
Right.
and when you go in the arena.
Yes. I completely agree. I
Very
see
good.
people in the warm up for, an hour and a half trying to reschool the entire Grand Prix test before they go in. It doesn't make any sense, but yes.
One other question that came in touches on ulcers again. But I think it also sort of reiterates some points that are important to hit that you talk about frequently. She says, my daughter's Welsh jumping pony started rearing and bucking, and after investigating had ulcers. We've had them treated. She's been given the all clear, but is still rearing under saddle when ridden. Not sure why and what to do.
Well, I'm absolutely sure there'll be a pain-related problem. The ulcers are probably a symptom of the stressors being usually pain. And we know that ulcers are induced by stress, and that's often musculoskeletal pain. So it's back to the drawing board, I'm afraid, in terms of trying to understand what the underlying problem is. But to be thinking about investigating ulcers as the first step in these types of situations is illogical, really, because there's no evidence that these behaviors, such as bucking and rearing, are induced by ulcers.
Well, with that, I think that we can probably preview our upcoming Facebook Live. So I'm just going to get this on screen so people can jot things down if they would like to. Except I have to share my screen first or else nobody can see it.
Can't see it.
There we go. So our next live with Dr. Dyson is going to be on the topic of ulcers, which we've touched on today. And I'm sure based on research and experience, Dr. Dyson has much more to say about. And that is coming up on Thursday, December the 7th. So we'll look forward to seeing folks at that time. We also have some more information. It's come up, right here talking about doing proper lameness exams and all of that. Sorry, got these messed up there. Finding a veterinarian who may be willing to do nerve blocks, finding a veterinarian who will do an exam of the horse ridden, the type of exam that Dr. Dyson is talking about a lot of times. We do have some new checklists that will be available on the 24 Horse Behaviors website. Selecting a vet. Dr. Dyson has made a list of questions that you can ask a veterinarian that will help you coordinate, and maybe you can ask your own veterinarian to see if these are options that they might have available. She has also provided a very detailed list of questions that for those of you who are veterinarians, you can provide to your clients, and as a client that you can answer for your vet before going in to provide a thorough history, the things that will really help your veterinarian understand what may be going on with your horse. So Dr. Dyson had put together that list that helps you to provide a thorough history. She has also outlined a great many additional behaviors above and beyond the 24 behaviors that have been included in the Ridden Horse Pain Ethogram checklist that may indicate underlying causes of pain very frequently. So those checklists are now prepared and ready on the 24 Horse Behaviors website. In addition, of course, Dr. Dyson's book that she has co-authored with Sue Palmer is available, Harmonious Horsemanship, Use of the Ridden Horse Ethogram to Optimize Potential, Partnership, and Performance. And that book is available through the harmonioushorsemanship.co.uk website and through Amazon as well.
I'm currently reading it, and it's excellent. Really, it's very easy read and very thought-provoking. It's not just a reiteration of the science. There's a lot of great questions, food for thought. Highly recommend.
Excellent. Well, we thank you, Dr. Sue, for being so present and making your information available to everyone. We're so happy that we're able to engage with this audience of people who really care about their horses and are open to learning all of this great new information that you have to share. So thank you so much. And thanks to everyone for joining us. And we hope to see you in December for our discussion about ulcers with Dr. Sue Dyson.